so many patients have spent so much time in different offices where they didn't understand the value, the care that you're providing. So become an expert in that care and then deliver that care for your patients and help them to understand the reason that it's important that they come to your office and experience the care that you're delivering for them. Greetings, I'm Dr. Greg Miller. This is the latest in the INNATE series brought to you by Aligned. Today we're going to do things a little bit differently than perhaps we have up to this point. We've spent a lot of time over the course of the last, oh goodness, I don't even know how long we've been doing the INNATE series. It's been a bit now. And a lot of you I know have been watching these and hopefully have gained a lot of information that you can take back to your practice and put to work this afternoon after you watch the video. But we're going to do, like I said, we're going to do just a little bit different this time. Often we bring up topics that are kind of standalone topics that we want to talk about. This one has to do with more of a foundational principle that exists inside of AMC. By this time, you've recognized that there's a lot of information that is available to someone who's a part of the AMC family. And for those of you who are a part of the AMC and the Aligned family, you know exactly what I'm talking about. But for those of you who are not yet, I'm going to pull the curtain back, or we are, over the course of the next 6 or so videos. We're going to let you take a deeper look at one of the foundational principles that we base everything we do on inside of your practices when you're a part of the Aligned family. So this one is called the 6 C's. Now the 6 C's, and I can list them for you. It's care, consequences, commitment, it's comparative costs, comparative treatment, and condition. Now, don't go trying to, put answers to all of those. We're going to actually do that for you, and I'll start today. But just understand that this is an important part of building the referral side of your practice. We talk about inside of Aligned having a self-sustaining, stress-free, referral-based practice. And this is one of the ways that we create that atmosphere. We create that foundation for referrals in our office. We've also many, many times in the past talked about helping you identify as the go-to doctor in your community. So today, I'm going to talk about care. Remember, I listed all 6 of them. Today, I get to talk to you about care. Now, when we talk about that, I was thinking about that this morning. Actually, had a conversation with a couple of my colleagues right here at the office, and we were talking about one of them had recently had a car buying experience. And we all know that some of you probably enjoy the opportunity to go out and buy a vehicle and have it out with with the system that exists in that car dealership. And of course, their goal, right, is to be profitable. And they're typically pretty good at that. So when you go to buy a car, okay, what's going to happen for you is you're going to hear benefit, 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 benefit. You're going to hear all of the things that this car gives to you and to your family. I can get into listing all those different things, but it's got a sunroof, it's got tinted windows, it has the engine that's more economical for you and your family. They're gonna ask you questions in the process and determine what's important to you, what's valuable to you. Inside a chiropractic office at AMC, we call that the need behind the need. So we want to tie all of those things together. But again, like I said, it's benefit, benefit, benefit. Then you share the cost. You don't ever say, well, this minivan is going to cost you $65,000 and here's why you should buy it. A good salesman is going to take the time to understand what it is that you need and therefore the benefit that this vehicle provides for you. So how do we tie that into your chiropractic practice and your relationship with a new patient? We're going to talk about the benefit that the care that you're going to deliver for them gives them in the end. If you've done a consultation properly, if you've done an exam properly, you know exactly what's wrong with them. Now you just need to tell them, here's what we're going to do to help correct your problem. Here's the care that we're going to provide you to correct this problem. And that's certainly going to include chiropractic care. And don't ever, ever, ever minimize the chiropractic care that you deliver. Please, doctors, if you don't hear anything else from me today, become an expert in the technique that you use in your office, because that is attractive. So many patients have spent so much time in different offices where they didn't understand the value, the care that you're providing. So become an expert in that care and then deliver that care for your patients and help them to understand the reason that it's important that they come to your office and experience the care that you're delivering for them. But in addition to that, many of the offices that I'm talking to right now have different therapies that are available. You're going to be using that as part of your treatment plan for them. What are the benefits of those different therapies? Why are those important in the big picture of the care that you'll be delivering? How about exams, re-exams, re-x-rays? If you're using a myovision or a scan of some sort like that, lay those things all out so your patient completely understands what will be provided, what the expectations are, what you expect to happen for them under the care in your office. What are the home recommendations that you're going to make? What are the exercises that you're going to recommend? What are the limitations that you're going to place on your patient for them to benefit from your chiropractic care that you're delivering? Value is such a big and important part of what is happening in your office, and the care that you deliver and the way that you present that to your patient becomes so very, very important. Ultimately, we're going to do whatever it takes to correct this problem for you using all of these different tools based on what you shared with us in day number 1. So I think it's important to understand, hopefully that all makes sense. Care is benefit, benefit, benefit first. Then you can talk to them about the cost. If you don't have a system for doing that, you need to reach out to us and let us know, because that's what we do. We will help you to do that. And we'll wrap that system around your personality and your desire to give the very best care for your patients. Reach out to us. Let us know how we can come alongside you and help you do that. Join us at our next training weekend, November 10th to the 12th. If you're new to AMC and would like a free guest pass to 3 days of material like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.